Please, could you give us an example of where you have delivered multiple complex projects on time? How did you prioritize the resources available to you efficiently and effectively? In my previous role, I managed two major projects concurrently: the rollout of a new digital health platform and an internal operational overhaul. Both projects had strict timelines and resource constraints. To prioritize effectively, I conducted a detailed resource assessment and created a shared project calendar to identify dependencies and overlapping resource needs. I implemented a task prioritization matrix that classified tasks by urgency and impact, allowing the team to focus on high-priority tasks without sacrificing quality. Regular check-ins and resource reallocation as needed helped us complete both projects on time and within budget. What experience do you have with change management? Are you familiar with continuous quality improvement (CQI) methodology? I have considerable experience with change management, especially in adapting to new digital tools and processes in healthcare settings. In a recent project, I led the transition to a new workflow management system across several departments, which required a structured approach to change. I used the ADKAR model, awareness, desire, knowledge, ability, and reinforcement, to guide the transition, which included engaging stakeholders early, training sessions, and follow-up support. I am familiar with CQI methodology and have applied its principles such as Plan, Do, Check, Act, PDCA, to improve efficiency and quality in project cycles, especially in healthcare environments where ongoing improvement is critical. Using examples, how have you helped establish effective working relationships with external stakeholders to support the work of your immediate team or the wider direct community? Can you provide an example of a time you have had to develop a standardized process or make significant improvements to an existing process? What difficulties did you encounter, and how did you overcome them? In my last role, I identified a need to standardize the way we tracked project milestones across multiple teams. Initially, each team used different tools and reporting styles, which made it hard to get a consistent view of progress. I developed a standardized tracking template in Microsoft Excel, automated with formulas, and provided training on its use. A challenge I faced was initial resistance, as some team members were attached to their previous methods. I overcame this by demonstrating how the standardized approach would save time and improve clarity. Over time, this new process improved project transparency and reporting consistency. The project manager role will include aspects of work which might involve taking into account potentially conflicting perspectives, either internal or external, and developing a constructive way forward. Can you tell us about a situation where you had to resolve such a conflict, and describe the techniques you used to find a way forward? I once managed a project where clinical and administrative teams had differing views on prioritizing patient engagement initiatives. To resolve this, I facilitated a structured workshop where each side could voice their concerns and share perspectives openly. I used active listening techniques to acknowledge each group's needs, and then encouraged both groups to focus on shared goals, such as improved patient outcomes. Together, we identified a compromise that allowed for phased implementation, balancing immediate administrative needs with long-term clinical goals. This solution fostered collaboration and ensured both perspectives were respected. Please tell us how you have contributed to a workplace policy or strategy development. I contributed to the development of a remote working policy in my previous organization, which became essential during the shift to hybrid work. I conducted surveys to gather employee feedback on remote work needs, which informed the policy's flexibility guidelines. Additionally, I analyzed productivity data to recommend best practices, which were then incorporated into the policy. This initiative resulted in a formal policy that balanced productivity with employee well-being, and it served as a guideline for managing work-from-home expectations effectively. How have you championed equality, diversity, and inclusion in your current or previous roles? Can you describe what difference you made? In my previous role, I led an initiative to promote diversity in hiring and career development within our team. I partnered with HR to implement diverse hiring panels and develop training sessions on unconscious bias. Additionally, I initiated a mentorship program to support employees from underrepresented backgrounds in career progression. These actions not only improved our hiring practices but also created a more inclusive environment where team members felt supported and valued. The impact was noticeable, as we saw an increase in diversity in leadership roles and positive feedback from staff on the inclusivity of our work culture.